Good afternoon and welcome to episode 1 of a look behind the job posting. I am your host, Paul Moss, and I am one of the recruitment marketing sourcing coordinators here at UNC Health. In these episodes, we're going to pull back the curtain and provide you with an in-depth look at some of UNC Health's departments and open positions. We have a very exciting show lined up for you today, as we'll be joined by the nursing managers of UNC Medical Center's operating room and the children's operating room, along with a registered nurse from the children's OR and recruiters for those units. If you have any questions or feedback during the show, please throw your comments into the chat and we'll get them answered for you. Our first two guests are joining us from Chapel Hill. Please welcome Rebecca Cintron, nurse manager for UNC Medical Center's operating room, and Tracy Karen, nurse manager for the children's OR. Ladies, thank you so much for your time, as I know you have a lot going on. If you both don't mind, please give us a little background on yourself. Where are you originally from, and how did you get into nursing?
My name is Rebecca Cintron. I'm actually the director of peri-op services here at the medical center. I'm originally from New Jersey. I got into nursing because a friend encouraged me to go to nursing school. And I know that sounds a little silly, but I did what she did, and it worked out great.
Glad to hear it. How about you, Tracy?
So I'm originally from Pittsburgh, Pennsylvania. I was an at-home mom for 17 years. When my kids became teenagers and they didn't need me around so much, I was looking to go back to work. I had no medical experience, and a friend of mine was a circulating nurse in a community hospital, and they had a program to bring surgical techs in, similar to our New to the OR program that we offer here at UNC. I got into the program. I did well. In about 2 years as a surgical tech, I went back to nursing school.
How do you think your staff members might describe your management styles?
For me, I would say democratic, collaborative. We encourage our employees to be empowered to share their ideas, to have a voice in our work practice. We reach out to them and we give them the opportunity to participate in what we do and how we get the work accomplished.
Agree with Rebecca. UNC, we try to all be uniform across the perioperative areas. So as far as I go personally, I think circumstantial as well as transformational. As Rebecca said, it's important that we get our team to collaborate with us so we can all move forward for the same vision. It's not a one size fit all. So you do have to modify a little bit depending on who you're talking to. But yeah, we have a great team.
For those who are not familiar with the operating room or the children's operating room, can you please give us a little background on those units?
Main OR has 26 ORs. We average about 70 cases per day, approximately 18,000 cases per year. We provide surgical care to adult and pediatric patients from all service lines: cardiac, vascular, transplant, thoracic, general, gynecology, urology, robotics, neurosurgery, ear, nose, and throat, orthopedics, plastics, oral, maxillofacial, burn, and dental. Our unit is operational 24/7, so we have a lot of flexibility in our work shifts. And with all of the different service lines, there's great opportunities to find what matches your skill set and interests.
As far as the children's OR goes, we're small, but we're mighty. We have 6 ORs. We average around 20 cases a day. We are a level 1 trauma center. We are open 24/7. We basically do all the same services of the main. We do burns, dental, ENT, general, neuro, oral maxillofacial, ophthalmology, orthopedics, plastic, of course, trauma, urology. The only thing we don't do in the children's OR right now are transplants and cardiac. We all have flexibility with schedules. It's a great place to work. We're a magnet facility, and we have a lot of fun in the OR.
Tell me, what makes your units different than other units?
Inpatient nursing is typically one nurse taking care of 5 or 6 patients. What is unique about OR nursing is that it's a team of 5 or 6 people taking care of one patient. So in the OR, your team consists of your circulating nurse, your scrub nurse or surgical technician, your attending physician, your resident physician, your anesthesiologist, and then either your anesthesia resident or the CRNA, certified nurse anesthetist, all working together to take care of that, to provide surgical care for that patient.
Just to spin off of that a little bit, I found an interesting read that kind of defines the OR for those who don't really know too much about it. They kind of compare the operating room to an ocean. It's very complex. It can be very scary such as Jaws, or it can be very fun and fascinating, like Finding Nemo. It's a fantastical world, and we integrate a lot of positive messages, and our teams are great. They refer to our circulating nurse as a sailfish that is extremely fast. They dart around the room, they try to get everything together for the patient, the service, the equipment. And it's like, and I quote, a sailfish on Adderall. So, anyone coming into the OR, you must, respect that circulator's time. You should introduce yourself to them, because she will just fly right past you. And then our scrub techs, they call Nemo, which is a clownfish, but I don't really like that name because our surgical techs are awesome. And their scrub table is like an anemone. So, Nemo never gets too far from the anemones, right? That's like the safety thing. So you never touch a surgical tech's table because it'll sting you. They're very quick, they're very efficient. You'll see instruments flying from their hands to the surgeons, and you just better not get in the way. It's a very streamlined machine, and it's a great team to work together.
I love the analogies that you gave. Those were great. Are there any fun or interesting things that you all do on your units that other units may not do?
I like that we get to play music at appropriate times while giving patient care.
Agree. It's not often that you can listen to some rock and roll or jazz or classical music while you're working.
I think that's great, and it sounds very therapeutic for your staff and puts them at ease. So I really like that. Speaking of your staff, what does a typical day for a nurse look like on the unit?
The OR nurse's day consists of learning their assignment, preparing their OR, interviewing and assessing their patient, collaborating with the team for the plan of care, positioning your patient, being the safety advocate for the patient during the procedure, documenting all of the patient care in Epic, then transferring their patient to the PACU at the end of the procedure and giving their handoff report, and then returning to the OR for room turnover and preparation for the next case to start all over again.
And can you tell me how many nurses you typically have working each shift?
It varies based on our volume, but of course, at 7 a.m. we have typically 30 at the main side, and then after 5 we decrease to about 20, and then after 7, as cases are finishing up, we decrease even further to about 6. But again, it fluctuates with our volume of cases and how late cases are going.
And that makes sense. Earlier, Tracy, I believe you mentioned the New to OR training program. Can you please tell me a little bit more about that?
Yeah, New to the OR training program is we get staff who are either new grads or currently working in the nursing field that want to join our team. They participate in a program. It's evolved around AORN's Peri-Op 101. It's initially a didactic class that goes for 8 weeks. Once they pass the didactic portion, pass their test, they come into our clinical sites and they work with a preceptor. During the didactic, they might have 1 day a week in the OR to kind of build on the skills that they're learning through the didactic time. But after the test, they work at our sites with a preceptor. In the children's OR, we're a little different. They continue their orientation 6 weeks to 8. It's dependent on the person and their skill set. But once they finish, then they'll be on their own. We try to get them trained in all areas. They go through all services. We orient them to off shift before they are able to start taking call.
Now, if you're driving past the medical center, you'll notice an enormous structure that's being built out front. Can you tell me a little bit about that, please?
Sure. The surgical tower is expected to open in April 2024. We will occupy the second and third floor in the tower with 13 ORs and 30 pre-op PACU bays on each floor. These ORs are planned to be much more spacious and equipped with state-of-the-art technology. We are so excited for our new surgical tower.
Are there any opportunities that exist for continued education or professional certifications?
Absolutely. The children's OR, we're growing. We encourage people to enhance their careers as well as continue their education. We have certified nurse of the operating room, a certification that is easily, able to be achieved after you have a couple years of experience. And we're all growing. So there's lots of room in the clinical ladder to move up.
We might have some listeners who are interested in joining one of your units. Can you provide them with some qualities that are not listed in the job description that you're looking for in an ideal candidate?
I think Tracy and I both look for someone that has a positive attitude, that is adaptable, that will be a team player, and that will have a strong focus on customer service and patient experience.
Do you have any advice for those who are interested in entering your field?
I think being able to multitask is an important thing. And advice I try to give to new employees is to keep a notebook. Kind of, it will be like your little diary and your little Bible that kind of helps you through those phases where you may forget. You go from service to service. You might be in one service and not back in that service for a couple weeks. Therefore, if you kind of keep notes and keep track of where equipment lives and surgeon preferences, then that will help you down the road.
I would just like to add the OR nursing is very rewarding. You contribute directly to patient outcomes, which could be anything from emergency care from a motor vehicle accident to cancer treatment to getting someone back on the golf course. We play a part in improving quality of life for many.
Rebecca and Tracy, I really appreciate the insight that you provided us today. So thank you so much for your time. Our next guest is a registered nurse in the children's operating room. Please welcome Taryn Keys. So you're a clinical nurse too, correct?
Correct.
And may I ask how long you've been in this role?
I've been in this role since 2016, so about 6 years now.
When you started in the new to OR training program, were you a graduate nurse or were you an experienced nurse from another unit?
I was a graduate, brand new baby nurse, straight out of school.
Was your transition into the program what you expected?
It was and it wasn't. I knew in nursing school, you're allowed to do 1 day of observation in the OR, which really you don't get the full picture in that 1 day. So I had a small idea of what I was expecting, but coming to the OR is a whole different world than what you're taught in school, mostly like the floor rotations. So it was a transition you have to adjust to.
How are you challenged in your role each day?
The OR, we try to prepare and we have a schedule where we think it's going to happen each day, but you never know. You have to just be adaptable, flexible. You could get a red trauma and your whole day is turned the other way, or the case might be going one way and then it could just turn left very quickly in the OR. So you just have to be prepared for the unknown.
How would you describe the working relationships between the staff and the environment on the floor?
You have to have a great relationship with your team, communication. The OR is very team oriented, which is why I gravitated toward it, because I'm a team player mindset. So you're never really drowning on your own. There's usually always support there to help you and help the patients.
What do you enjoy most about working in the children's OR?
I would say I enjoy most working with my team. We all get along great. We all know our roles. When I come to work, I know that I'm going to have a good time, basically. So we have a lot of good team bonding, and I like the staff I work with. So that's probably the best part.
And that's a trend I'm noticing in this interview is team and collaboration. So I think that's huge.
Yes, it is.
Is there anything you wish you knew before coming into this position?
I would say maybe when I first started, a lot of nurses put a lot of pressure on themselves because it's kind of information overload. Because like I said, you're not taught these things in school. And that's why the new to the OR program is so vital, because it's just so much information you have to cram in these few months. But just to tell new nurses, don't put too much pressure on yourself. With experience, you'll learn things, and just know who your resources are and who you can reach out to when you need help. Don't be afraid to ask for help.
Taryn, you have been great. Thank you so much for joining us.
Yeah, thank you, Paul.
Our final guest joined us from the nursing employment team at UNC Medical Center. Please welcome nurse recruiters Kelly Benson and Marsha Davis. I was hoping that you might be able to tell me about the incentive opportunities that are available within the OR and the children's OR.
So currently, we have several incentive opportunities. The children's OR and the main OR both have opportunities for nurses, experienced nurses coming in as a CN2 or a clinical nurse 2, to receive a $10,000 sign-on bonus, as well as a $20,000 incentive commitment agreement that is paid out over 3 years. Our surgical techs for both of those ORs as well is a $5,000 sign-on bonus with a $10,000 incentive commitment. And that is good for the main OR, children's OR, as well as our one of our outlying hospitals as well on the Hillsborough campus. For our pediatric congenital heart program OR, we also have bonuses for them. And that is a $10,000 sign-on bonus and a $25,000 commitment incentive, or up to $25,000 in tuition reimbursement.
You have relocation as well, don't you?
Yes, relocation is also dependent on mileage. You get anywhere from $2,500 up to $10,000, depending on how far out they live.
Just to get this straight, if I was in the congenital heart program nurse, I can get $10,000 in addition to up to $25,000 tuition. And if I live far away, I can get another $10,000 relocation, which is like $45,000.
You could, or you could get the $10,000 if you live far away, $10,000 sign-on, and $25,000 incentive, or the $25,000 tuition reimbursement. So there's a variety of ways that you can make a lot of bonus or incentive pay.
That's a lot of money and a great incentive for a nurse. Kelly, I know you're both extremely busy and you've been screening a lot of applications as of late. What is one of the most common errors that you see when people apply to a nursing position?
One of the most common things that we see are that either they don't attach a resume at all, or when they're filling out the application portion, they don't double check their dates of employment and education. So, systems sometimes will default to a certain date and they might think they put it in correctly, but it defaults to December on everything. So just really double checking those dates that you enter and then just making sure that you upload that resume.
Marcia, do you have any tips for our listeners on what they can do to spruce up their resumes?
It's really good if you could tailor the resume to the position that you're applying for. There are many times that we'll open the resume and the top part of it may say, I'm looking to join your women's L&D, and it's for an OR position. So you want to make sure that you tailor your resume to the position that you're applying for, and making sure that you put all relevant information on the resume as well. Making sure you put in your job work experiences, those places that would help support the role that you're looking for. And be sure to, incorporate words that show that what you've achieved and what you've accomplished for those areas as well, to show your strength in that particular department.
This question is for Kelly. Once the resume is complete, do you have any tips on filling out the application?
Yeah, I do, Paul. I would say, first of all, make sure you're really reading the instructions carefully so that you're entering all the information correctly, and have everything in front of you when you're applying. So your resume, your references, the job description itself, your previous employment dates, phone numbers, email addresses, salary details, all of that stuff, so that you don't have to go looking for it, because sometimes, you leave it out and you think you're going to come back and fix it, but you forget.
Is there anything you would like future applicants to know before they apply for a position?
I would say make sure that you are updating your resume and including everything that you have. So a lot of people think that, they're not going to include anything past 10 years in their history. But the truth is, as a nurse, we need all of your history of nursing. That's how we come up with your pay. In addition to that, including other healthcare experience, like, were you a nurse aide? Were you a surgical tech, an LPN or an EMT? Having all of those things on your resume really gives us, the recruiters, the managers, a better picture of who you are and your experience, but also comes in later when we're trying to figure out your pay.
I would add to that too, when you're making sure that all your healthcare experience is there, make sure that when your resume is submitted, that you've updated it to include your current role. Many times we'll see resumes that come across and they're in an RN role for several years, but the last resume maybe they worked on only showed it up to CNA level. And so sometimes, if we don't see that you're currently in, say for the OR, that you're working in the OR and you just listed as that CNA level, we might swipe left and, not know that you do have that current experience.
Another thing I would recommend is, if you're making a big change, say you've worked in women's for years or children's for years, and suddenly, you want to be an OR nurse, attach a cover letter. The managers really appreciate, getting a feel for why are you interested in this position.
Kelly and Marcia, it's been a pleasure. Thank you so much for joining us today.
Thanks for having us.
Thank you.
That concludes our first episode. I want to thank all of today's guests, Rebecca, Tracy, Taryn, Kelly, and Marcia, for providing us a look behind the job posting. I learned a lot today, and I hope you did too. Please join us next month when we are joined by our data analytics team. Until then, remember to see yourself at UNC Health.